Hello everyone, I'm Namita Thapar, Executive Director of MCure Pharmaceuticals, and this is a super interesting episode that we've got for you, which most of you can relate to. It's on alcohol.
Most things that are fun and enjoyable are either illegal or dangerous to health.
Okay, red wine pio, so it's good for your heart.
Recommendations now say 2 for men and 1 for a woman.
But there are a lot of my friends who say that alcohol helps them sleep.
You are walking very thin ice there.
So women need a much smaller amount of alcohol to develop the ill effects of alcohol on the liver.
Even one drink can drop your oxygen saturation in the blood.
Beer is mild, it's not alcohol and it cannot cause damage.
Once or twice a week is not such a bad thing. So were you just justifying your once or twice a week?
And therefore it's the fluid for social interaction.
As the Alcoholic Anonymous group says, 1 day at a time.
Correct.
Just try it 1 day at a time.
And we have 2 experts from 2 completely different specialties. We have Dr. Aabha, who's a liver specialist. We have Dr. Joy, who's a neurologist. So you will get very different perspectives on this very, very important topic that pretty much impacts everybody's lives. Let's talk with you, doctor. The brain. What is it about alcohol that's so addictive, so fascinating, that there are different ways of making it, tours in Napa Valley and everywhere you can imagine that glorify it so much?
The way I see it, I think it's an experiential thing. The consumption of alcohol, it feels good for your gustatory senses, for your taste, depending on what you're drinking.
Mm-hmm.
Plus, there is this clear perception that once you have had a little bit of alcohol, a part of your social inhibition gets mellowed. And that mellowing of social inhibition leads to a greater bonhomie and camaraderie amongst people. And therefore, it's the fluid for social interaction. So
that
you'd not
is
be
the
surprised
fascination.
that alcohol flows and parties happen.
Mm-hmm.
And
But then the second part of it, since you're the brain specialist, what damage does it do to the brain if you don't drink it responsibly?
well, someone has said that most things that are fun and enjoyable are either illegal or dangerous to health. And alcohol, I think, is also one of them. Certainly, consumption of alcohol is deleterious for the nervous system because it's a suppressor. So what alcohol does in the brain is that it suppresses your brain cells' functionality. And that's what leads to suppression of not just brain activity, but also muscular activity too. And regular consumption of alcohol can whittle away a little by little at your cognitive abilities over time.
Mm-hmm.
And we know that regular alcohol can deplete the number of cells that exist in your neural networks. Alcohol per se is not good for the brain, and there are all kinds of numbers that have been floated. But the experience of alcohol being what it is, it's still a social fluid.
You told me there's a lot of literature publications to show that it's linked to several forms of cancer as well, right?
So various things. The biggest thing to know, I would think even before we get to the cancer story, is the suppression of sleep. So if one consumes 2 drinks or more before bedtime, it just makes your deep sleep become much smaller in quantity, lesser in depth, and torn into a kind of disarray by frequent awakenings. And a lot of people who do have social alcohol also admit that the nights that they have had late alcohol and slept, they have not slept too well. That perception comes from there.
But there are a lot of my friends who say that alcohol helps them sleep. Like, on a flight, you'll always find people having a little bit of red wine saying this makes me sleepy.
You are walking very thin ice there. People serve alcohol on flights.
Yeah.
And the perception is that it may make you initially sleepy, but your sleep quality and depth is not good.
That's the point.
But there's a very interesting study published just about 5 months ago, showing that when you're flying in a commercial liner, your aircraft is at 37,000 odd feet,
Right.
but your cabin's pressurized to about 11,000. When even one drink can drop your oxygen saturation in the blood to as low as 80%.
Oof, okay.
So this study has been published from Germany, and in fact it provoked a furore in the editorial network of that journal, saying that actually, as for advocacy, we should stop serving alcohol on flights because it just suppresses your breathing. If you have sleep apnea, then you can imagine what it can do to you when you're drinking alcohol on a flight.
My God, I think a lot of these studies definitely need to be published in layman terms so people are aware of this. Now, over to you, Dr. Aabha. I want to understand from a liver perspective what damage it's doing. And I know we've become a fatty liver capital almost of the world. And on top of that, this is a double whammy. So tell us more about what it's doing to your liver once it goes in there.
So traditionally, alcohol has been linked to the liver and liver disease. So there are several stages of the damage. It starts with a simple fatty liver. In fact, in the past, we always thought fatty liver is equal to alcohol until we realized there's something called non-alcoholic fatty liver disease. It was always alcohol and fatty liver. As one continues to drink, you could have hepatitis, where the liver gets inflamed and swollen, and then it progresses to cirrhosis. So about 20% of those who have a fatty liver will develop cirrhosis. And in any cirrhosis, including alcohol, you could develop cancerous tumors, what we call hepatocellular carcinomas. So it's a whole spectrum, depending on how much you're drinking, how long you've been drinking. So it can cause cancers in the liver. Besides, you asked a question on cancer, it can cause cancers of the food pipe, the esophagus, even breast cancer risk is more, and head and neck cancers, which are, India is the head and neck cancer of the world, capital of the world. It can cause head and neck cancers as well. So in the liver, it's the whole spectrum.
Yeah, that's pretty large number, 20%.
The message people should get from Aabha's narrative is that the liver, which is nice and soft, is now getting harder as you develop cirrhosis across the spectrum.
Absolutely.
So the question is, why is this happening? So alcohol is producing damage. So it produces something called inflammation. So your cells are inflamed. And when they are inflamed, they are perceived by your body's responsiveness system as injury. So as a reaction to the injuries, cells come into play, the SWAT team of the immune system, and then they produce tissue which is fibrous. So the liver starts getting harder with the activation of these cells. So the bottom line is that it's injurious, and people have tried to look at it, and we think that alcohol is injurious to essentially the energy producing components of the cell, which has many other functions called the mitochondria. It's anti-mitochondrial. And depending on where it hits you, it can hit the mitochondria in the brain, it can hit the mitochondria in your liver, it can hit the mitochondria in your pancreas, it can give you an inflamed pancreas and give you pancreatitis.
And that's why the link to multiple cancers. Now, Dr. Aabha, when we spoke earlier, you also spoke a very interesting term about it manifests differently in men and women. And of course, I'm going to ask both of you, we'll start with her on the very, very dangerous topic of how much alcohol is okay. So why don't we start with you, how much is okay, different types of alcohol and the difference in men and women. And then of course, I'm sure Dr. Joy has his own very interesting perspectives on that.
Yeah, so I mean, it's a common question where somebody asks, husband and wife sitting together. The wife develops cirrhosis, which is the scarring of the liver. Husband has had nothing. So it definitely has been shown that women get affected with much lower quantities of alcohol which have been consumed. That is because there's an enzyme called alcohol dehydrogenase in the stomach, which in women is less. So it does not get detoxified and it goes straight to the liver and damages it more. So women need a much smaller amount of alcohol to develop the ill effects of alcohol on the liver. But there are several other factors. If somebody is obese, somebody is diabetic, all these factors will increase your risk of developing alcohol-related liver disease.
Understood.
So, so these are the people. So that is linked to the question of how much is safe and what are the different alcohols. So you can have right from beer, wine, and the spirits, and I don't want to list the spirits, like vodka, gin, whiskey, rum, all these, which have a much higher percentage of alcohol. Generally, when people talk to us and we ask them to stop drinking after they've had a liver problem, they'll say, yeah, they've stopped drinking. And you look at their numbers and the liver numbers don't look right. So are you sure you've stopped drinking? Yes. Are you sure? Yeah. So what about beer, wine? Yeah, that I take, that's not alcohol. So that's a general conception that beer is mild, it's not alcohol and it cannot cause damage. But the percentage of alcohol is less. I mean, it's 4 to 11% or whatever. Similarly, in wine, it's less. But whenever we talk of damage to the liver, it's the grams of alcohol that you consume. 30 to 45 ml of whiskey or spirits is 100, 150 ml of wine and is 350 ml of beer. So all these are 10 to 12 grams of alcohol.
Okay.
So you're not going to have 130 ml of beer. You're going to have 350 ml.
Yes.
So at the end of the day, it's the same number of grams of alcohol that you're consuming, and therefore they are all as harmful as each other.
I'm so glad you mentioned that, because there's always this thing like a red wine pio, though it's good for your heart, and this was like so popular back in the day.
Yeah.
So I'm glad you mentioned that.
Yeah.
So what's a good amount according to you to have?
So, I mean, if you look at the various gastro society, like the British Society of Gastroenterology, in the past said 3 drinks a day for men and 2 drinks a day for women are okay. But over a period of time, we realized that those were not okay. Recommendations now say 2 for men and 1 for a woman on a daily drink. And 1 drink is 10 grams, what I mentioned. But the point is that the one who is taking a drink a day, what else does that person has? Is he obese? Is he diabetic? Does he have a genetic predisposition? It's known to run in families. So if the father was drinking and had an alcohol-related problem, it's a good chance that the child will also have. Women who drink when they are pregnant, there's a good chance that the children will have a related problem.
Right.
Japanese, for example, do not become alcoholics because they metabolize it in a different way. They get a reaction, a rash, because they are having some mutations in their enzymes which kind of break down alcohol. So they would not drink much. So they have a lesser problem than others who do not develop a reaction. So there are so many
even by
factors.
nationality, the way you metabolize is different.
So gender, nationality, what are the other diseases you have, all that will finally influence whether you are developing a disease or not. And finally, how much should you be drinking?
Is okay for you.
Yeah.
Don't forget social habits and tradition.
Yes.
So in many societies, alcohol is known, and in colder regions of the world, alcohol is consumed as one of the things that keeps you comfortable when it's cold. So it's many things. I mean, when you talk about the absolute health, certainly absolute health is at risk.
Yeah.
And she just mentioned obesity and diabetes, and they're all susceptible mitochondria. So if you really see in both these conditions, what is at play is you have dysfunctional cell components.
Yeah.
They're already susceptible, then you are burdening them with consumption of a greater amount of alcohol. So then you're tipping.
But the data
balance.
seems to be so off. Like, for example, she said 1 to 2 drinks. Earlier it was a lot more, but now 1 to 2 drinks a day is considered moderate or responsible or social.
Right.
And then I met a couple of psychiatrists earlier in the day, Dr. Rashmin and Dr. Ashutosh, and they said, no, it's not 6 to 7 a week that's responsible. It should be 6 to 7 a month. So I think, is there some consensus? I mean, of course, everybody says it should be 0, but supposing 0 is practically not possible,
It's practically
are there
not
any
possible, I can assure
guidelines
you of
of
that.
what is considered social drinking or responsible drinking at this point that's published as this is considered social or responsible?
I don't know. The way I see it,
Because I haven't found it. I mean, I've been
I think
combing
daily
literature, I'm
drinking
not
is bad
finding
news.
it. Sorry?
Daily drinking is certainly bad news. If you drank once or twice in a week, modestly, knowing that not more than a drink or 2 at a time, you might get
So
away.
1 to 2 a week is what you're thinking.
But there's a rider there. Why is daily drinking bad? Because you're not giving the liver an opportunity to regenerate. See,
just kinda like flush it out.
When you take a lake in Padushan, people stop drinking.
Many things.
So they are actually giving a chance for the liver. Liver is the only solid organ in the body which has a fantastic capacity to regenerate. So you drink once or twice, in the meantime, the liver is regenerating. You drink daily, it's a problem.
It's not giving the liver time to...
But there's a rider there. If you do binge drinking, you say, okay, I drink only on the weekends with my friends. It's a binge drinking. Now, what is binge drinking? By definition, 5 drinks for a male and 4 drinks for a female.
I know people do a lot more than the 5 drinks.
Within 2 hours is binge drinking. And that's worse. So, the current trend is, okay, I'm not drinking daily, but I'll have it socially on the weekend, but that's binge drinking.
Why is that worse?
Because it can cause situations like pancreatitis. It can also lead to a situation called alcoholic hepatitis, where you don't need to be drinking daily for many years. Just a 6-month history of drinking is good enough for you to develop jaundice and a very severe inflammation of the liver, which can be life-threatening.
Okay. So that's
Plus,
about binge drinking.
It can destabilize your autonomic system. So binge drinking is certainly bad news. So especially the thing in weddings where you have tequila tankards being being piped into the open mouths of people who are dancing.
Yeah, and glorified.
It's a trend, but younger people don't know, and people think that youth protects them. So if the mentions were of diabetes and obesity, but if you're sedentary and you're a bad sleeper, that makes you even more susceptible because again, all these things deplete your reserve. So you've got to think that while it's people socially and experientially enjoy their alcohol, that the need for balance, I think, should come out, even if people are not willing to give it up completely.
And I remember I had this very fun conversation with you where you said that from a brain perspective, there's a whole, your serotonin going up, your oxytocin kicking in, and those feel good when you are having a social connect. And sometimes alcohol helps with that. So maybe once or twice a week is not such a bad thing. So were you just justifying your once or twice a week, or you stand by that as well?
I think the verdict is never going to be out because all our studies are limited by the parameters within which you do a study. So there will be tons of people who will show you studies that red wine decreases inflammation, antioxidant activity, and coronary thrombosis, right? And people link that to what comes from the grape skins of red grapes, resveratrol. And there are other phenolic antioxidants. Now that's also available as a supplement, but nobody's consuming the supplement because people drink wine for the pleasure of drinking that wine. They're not drinking it because of the resveratrol. They might say so, but you ask someone who loves, I have friends who love their Chianti and they will swear by it because I'm sure you have people in your family who are.
Of course.
So the experience, the gustatory experience certainly is what makes it thrive. So you can't completely get people off.
And not just that, it's almost like I said, I mean, if you know your wines and if you know the aging of your whiskey and you know the Japanese names, it's almost considered cool. So I think there's a little bit of the alcohol industry has worked very hard to make it very cool to become a PhD in alcohol.
Body of literature on how just oaking an alcohol can make the alcohol seep in and out of wooden casks. And there are different ways of preparing these casks. And it breaks down the lignin in the wood. And that lignin produces, again, flavonoids and antioxidants. And it gives taste. So depending on what wood you're using, which oak you are using, there are 3 different kinds of oak. So your bourbon and whiskey can taste either of caramel or chocolate or spice or coconut. And therefore you have the aficionados saying that, what is the nose? What does it smell like when you smell it? And what is the taste and what is the finish? What's the last thing that you feel when you have swallowed the whiskey?
No, but I'm really glad you spoke about, the fact that...
And there's a huge chemistry to this.
There's chemistry to this, but then, the myths you spoke about in terms of the sleep and all of that, I think that's important for people to know.
So I have huge number of friends and colleagues and patients who love their alcohol. And I often tell them that if they like their drink, it's better to drink when you are at brunch. So do your parties in the early evening.
Yeah.
So if you look at the Europeans have their wine and cheese between 5 and 7. And then they go to sleep by 10 o'clock. So they've already metabolized their alcohol by then. What's happening here is that we are drinking very late in the night, 9, 10, and then sleeping at 11 and 12. So both late sleep and late alcohol is a huge sleep disruptor.
It's a double whammy.
It's a double whammy.
Anything else, Dr. Aabha, that you'd like to add from an alcohol? Because I also wanted to go back to Dr. Joy to speak about the addiction part of it. Because I think addiction is a very important topic we need to touch about where alcohol is concerned. So we'll come to that brain aspect of it. But when someone comes to you where the liver is slightly damaged and then you tell them you got to cut back on their alcohol, are they able to do that? Or it's become such a big part of their routine that it's very difficult to do it. So what are some of the tricks or tips you give them to cut back?
So we like to actually assess how much of dependence they have on alcohol. There are several questionnaires. One simple one is what we call the CAGE questionnaire. So we ask them, do you feel, CAGE is an acronym, C for whether you feel the need to cut down because, you're seeing the effects of it. you get annoyed when people talk to you about alcohol.
Right.
G is whether you feel guilty about drinking, and E is about whether you feel that you need alcohol as an eye opener in the morning.
Oh.
So if any two are positive, are yes,
Okay.
then you know that he has an alcohol use disorder, and that this is a patient who will be finding it very difficult to give up alcohol. And as a liver specialist, we realize that these, patients know ways around. So people in the early stages of liver disease would come. They know they have a visit 1 month later. 2 weeks before, they will start cutting down. They know their numbers will get better and we'll not know whether they are drinking. They'll say that they've stopped drinking. But over a period of time, they can't do that and it can't be hidden. So I've always felt that we should do something beyond just treating their liver disease. Because if we don't address the root cause of the problem, which is drinking, the liver disease is going to progress. We'll send them for transplant at the most, but that is not really a long-term answer.
Right.
Because even after transplant, those who are not motivated to stop drinking will continue to drink. And it's a whole waste of so much effort put in by the patient, the family, the medical team. So I think we should, even as liver specialists or anybody, as a doctor or in the medical profession who is treating patients with an alcohol-related problem, should go one step beyond in seeing how they can make people stop drinking.
What are some of the tricks that you've given people to, slowly cut back on this habit?
So one thing I've found useful is the Alcoholic Anonymous meetings. I used to have some of them for my patients in my own clinic. And do you want me to tell you a little bit about AA?
Please.
So basically, there were these two individuals, Dr. Bob Smith and Bill Wilson, who just met each other incidentally on an airport. They were waiting for a flight and they started talking to each other. And they realized that there was one thing in common between them. They both had an alcohol problem. And they just kept relating one story to each other, one story after the other. And they realized just by chatting with each other, how much they could convince the other about the bad effects of alcohol and that it needs to be stopped. So they expanded it. That was way back in 1935 in the US. In 1939, Alcoholic Anonymous organization was formed.
Right.
It's now over 180 countries, including India, and we have several centers in Mumbai itself, where the only criteria for enrollment is your need or your wish to give up alcohol.
Right.
There's no money, it's across socioeconomic barriers. You just go, sit there, listen to people who have given up alcohol and who relate their experiences. And as a newcomer, I can go there and give my experiences and you exchange notes. And that itself is quite effective in giving up alcohol. So something like this, I think every doctor, every medico who comes across these people should try and do.
Support groups.
Support
basically.
groups. I
That's
think
very
support
important.
groups help. It's easier to say, okay, go see this psychiatrist. But I don't think just drugs are enough for help. I mean, you do need drugs sometimes, but I think it should be support group, not only for the patient, but the family, the spouses. They need great support because they are the ones at the end of the day who are also suffering.
And they're taking the brunt of it.
And taking the brunt
firsthand,
of
right?
it. So yeah, I think that's what.
No,
is needed.
that's a great point. I mean, we need more of those support groups.
Yes.
Dr. Joy, again, from a brain perspective, let's talk about the addiction. And then what are some tips for both the addicts as well, maybe not so addict, but want to start cutting down?
It's quite a bit of an enigma. We know that some people are wired to chase pleasure. And a lot of work has been done on this. The pleasure networks in the brain are being understood as a very intricate neurobiological construct. And there's a great diversity in what kind of how these networks behave. And it depends on what kind of dopamine network there are. There are different kinds of dopamine receptors in the brain. There's a little hub called the nucleus accumbens. And that's the pleasure center in the brain. And if you actually put in an electrode there and stimulated it, there's a constant sense of well-being. And it's used for treating recalcitrant depression. So there are deep brain stimulation therapies for recalcitrant depression where the nucleus accumbens is targeted. So we know that the pleasurable experiences of life can be diverse from person to person. We also know that the ability to stay at abeyance and give up something is also a diverse thing. And in all our cultures, there are months which have been designated that in some months you will not eat or drink in every culture. So you have the Ramadan, you have the Shravan, and you have other sociocultural setups being made where people are encouraged not to chase pleasure. It makes you less vulnerable to constantly consuming things that make you feel good.
Right.
So I don't think there's a big one answer because of the diversity that we have, and each individual has this. And sometimes it's important to ask the patient too. That I often ask, especially in young people, when they have difficulties with their headaches and seizures, I ask them, how hedonistic are you? So how often are you sleeping late? How often are you drinking? And now even how often are you doing grass? Because the urge to chase pleasure is very omnipresent. And we also need to create the awareness that giving up things for a period of time can also be rejuvenated.
Absolutely.
It can bring you back both cognitively, mentally, and health-wise.
And I know you're a big advocate of right breathing, meditation, or walks. So, of course, there's a lifestyle aspect of it which can also help you cut back
So
on
you
your
can
alcohol.
find pleasure in other things.
Yeah.
So while there is gustatory pleasure, there can be pleasure in other things.
Yeah.
And we have our five senses. So we got to use those senses. In how often you're using which sense is what matters.
Absolutely.
There are people who will lean towards one. And those leaning towards one some will be normal.
I remember when I was in the Bay Area, I had a friend who had, because I don't drink, she had told me to be sort of her little auditor. And so at parties, I would always keep a check. How many are you drinking? How many have you had so far? So she knew I'd always come and ask her. Secondly, she would sit with either club soda or apple juice.
Oh, yes.
You discussed apple juice last night
Absolutely,
with me.
apple juice
And then you
and
can fool your friends who are
water.
putting pressure on you, right? So there are these couple of little things that you can also do to...
But the discipline is intrinsic.
Yeah.
So one has to understand that when do you rein in that, okay, we've had pleasure, but beyond this it may be harmful. So that discipline is intrinsic. It's the same with food.
Yeah.
So if you're going to deal with exercise, food, obesity, that's where your discipline comes in. Unfortunately, I don't have a great idea of whether there's a neural construct for discipline. I don't know that.
And I think it's, again, like you said, building a stronger core inside. I've dealt with emotional eating for years, and it's just when I went deeper into breath work, meditation, solitude, your awe, treks and walks,
self-belief,
and self-belief, and a lot of just inner work that I developed the ability to stay away from that sugar at 10 p.m. at night. So I think that's true for alcohol as well. I may not drink alcohol, but I had it
so this
in some
social
other
validation.
form.
So
Right.
this, when we also live in an age where all our social media are saying that our validation depends on the validation from others.
Yeah.
So if you don't have enough thumbs up on your Facebook or Instagram. So the same thing happens in parties too.
Yeah.
So if one has a intrinsic sense of validation, one may find that discipline not to be pressurized into excesses of any kind.
Absolutely. A very philosophical turn to the entire scientific conversation, but very much needed. Is there anything else that I may have missed on this very interesting topic of alcohol? I think we've looked at every dimension there is.
Yeah, I would just like to add, don't have any long-term goals when you're thinking of stopping. As the Alcoholic Anonymous group says, one day at a time.
Correct.
Just try it one day at a time.
Yeah, like take baby steps.
Yeah,
Baby
take
steps are
baby
very
steps,
important. I think this was just such a fascinating topic. We all glorify alcohol. Like I said, those Napa Valley walks and tours and experiences and knowing, almost becoming a PhD, knowing the age and what winery your alcohol came from. And of course, at parties, there's so much pressure. And in the midst of all this, sometimes we forget what it's doing to our brain, what it's doing to our body, what it's doing especially to our liver. And this is such an important conversation that is needed. We need to talk about it because long term, it does disrupt your body. Best if you don't have any. But if you must have some, at least know what it's doing to you. At least know what responsible drinking means. And I hope this episode helped you figure some of that out. Thank you very much. But I do hope that these kind of things show people the mirror, that these are the facts. Just like you're glorifying alcohol at parties, listen to the scientific facts and then you decide what you want to do with your
But
life.
they will also tell you, na, ye jeena bhi koi jeena hai.
Hey, bhai, you should have ended with that.